Hi there, Chris Coleman, certified hand therapist here for helpforthehand.com, and today I wanted to talk a little bit about when to use heat after an injury and when to use ice. It is one of those topics that I find myself pretty much on a daily basis saying either once or saying a number of times to patients that I see, and my feelings on it are this, is that when you sustain an injury, a tweak of something, of a muscle, some soreness, from arthritis or tendonitis, or even post-surgical. Everyone likes to run and put heat on it because it soothes and it feels great. And that is fine to some degree, but when you remember what heat does is heat brings swelling or inflammation to the area. So if you have an itis, tendonitis, bursitis, arthritis, synovitis, any of those itises, itis is Latin for inflammation. So if you already have an inflammatory condition and now you are bringing more blood inflammation to the area, while it soothes the tissue and it feels pretty good, you're compounding the issue. So I think ice is a much better thing, and what I use for myself when my SI is sore, or when my hamstring gets tweaked, or when my shoulder gets sore, I will immediately put ice on it for 10 to 15 minutes at a time. And what you do is you take a frozen bag of peas, or you take a formal ice pack, and you wrap it in a thin dish towel or even in a t-shirt, and then put it on the shoulder, put it on the knee. You can lay on it on the back, no matter what it is, but do that for 10 to 15 minutes. And that cold will reduce inflammation, which is usually the root of what you're trying to do. So what I say to people typically is if you're going to do heat, because it soothes it and it feels great, which often in cases of arthritis or soreness, the heat always feels good. Everyone likes that. That's fine to do, but make sure you follow that up with ice after the fact. And if you're going to do one thing, make sure you do ice, because again, ice is an anti-inflammatory. It does have some pain relieving qualities to it as well. And it will help reduce the inflammation, which is usually the root of your problem. So that's the heat ice discussion I typically have with my patients. And I think if you do that on a religious basis, meaning every certain number of hours or at least once a day to a condition, you'll tick down that condition and save yourself 20% in the soreness or the pain. I'm a big advocate of doing the ice right before you go to bed. Because if you think of a fuel tank and it's full with inflammation, when you go to bed, our body, what we do when we rest ourselves and get some sleep is our brain sends blood to the area that it gets the work orders and sends the blood to the area where it needs to go. So your brain says, all right, go to the right thumb, go to the left shoulder, go to the knee, and that's when you get inflammation. And because you're not moving so much when you're sleeping, it tends to pool there and sit there because you don't get the muscle pumping action to get it out of there. So if you lower the tank by putting ice on something right before you go to bed, then as the body sends blood there and it raises it up, you don't spill over, so to speak, and then wake up with stiffness and soreness like you would if you didn't lower the tank right before you go to bed. So that's the heat and ice discussion. If you have any other questions, please feel free to reach out to me. jchriscoleman@gmail.com is my email address. Helpforthehand.com is the website where you can go to get a lot of information about upper extremity conditions and certain things. And I'll be posting something on there about heat and ice and my feelings on it, just for a reference as well. So take care. Please reach out if you have any questions or concerns on anything, and have a great day.